Whenever I'm talking to patients about their vitamin panel, they're often shocked that they have all these deficiencies because they're like, they eat a really clean diet, they really take good care of themselves, they do feel horrible or at least pretty bad, or they wouldn't do the panel. Don't get people that feel really good doing those panels very often, and they can't believe that they have these deficiencies. The reason for those deficiencies are that it's genetic. Like, you may have a tendency to need extra vitamin D. That's called VDR-TAC or VDR-FOC. There's also a CYP SNP that causes your receptors not to form correctly for vitamin D3, so you need to use vitamin D2 instead, which is really interesting. That's why your intracellular Ds are low. Maybe your serum levels are high. It doesn't mean anything if it's not getting into your system or getting into your cells. You need to realize that. Also, there are certain SNPs that require you to use extra taurine or extra NAC. There's a lot of SNPs that require you to use a lot of glutathione. There's a reason why it's the most common antioxidant, most powerful antioxidant in your body. It's very, very useful for a lot of different things. So these SNPs, these transcription errors that have been passed down, they're not mutations. They're mutations when they occurred originally 1,000, 5,000, 10,000 years ago. How fun for you. And they're getting worse because each generation piles up with more SNPs. That's why we're seeing more anxiety. That's why we're seeing more depression. But most of it is dealt with by treating the vitamin deficiencies, the intracellular deficiencies to be exact, that those SNPs cause. SNPs or transcription errors, the mutations that your ancestors had, can affect you in three ways. One, they cause you to overutilize. Let's say you're overutilized in D3. Number two, they cause you not to build out the proper receptors for D3. Or number four, they don't let you absorb it at a gut level and you can't even get it in. That's rare. Usually it's the first two. Hope that helps. This is Dr. Dan Purser. Thanks for listening.